Hi friends, welcome to the channel Dinners. Here we are discussing about therapeutic patient positioning and its uses. If you are not subscribed to our channel, please subscribe. Therapeutic patient positioning. Positioning patients correctly is important for a variety of reasons. In surgery, proper positioning provides optimal exposure of the surgical site and maintenance of the patient's dignity by controlling unnecessary exposure. Additionally, positioning patients provides airway management and ventilation, maintaining body alignment and provide physiologic safety. The common positions includes listed here with explanation. Follows position, orthopnic or tripod position, supine position, dorsal recumbent position, prone position, lateral position, Trendelenburg and reverse Trendelenburg position, Sims position, knee chest position, lithotomy position. So first one, Fowler's position. Fowler's position is a bed position wherein the head and trunk are raised to 40 to 90 degrees. Fowler's position is a bed position wherein the head and trunk are raised to 40 to 90 degrees. Fowler's position is used for people who have difficulty breathing because in this position, gravity pulls the diaphragm downwards, allowing greater chest and lung expansion. In low Fowler's or semi-Fowler's position, the head and trunk are raised to 15 to 45 degrees. In high Fowler's, the head and trunk are raised 90 degrees. This position is useful for patients who have cardiac, respiratory or neurological problems and is often optimal for patients who have nasogastric tube in place. This position is useful for patients who have cardiac, respiratory or neurological problems and is often optimal for patients who have nasogastric tube in place. Using a footboard is recommended to keep the patient's feet in proper alignment and to help prevent foot drop. Using footboard is recommended to keep the patient's feet in proper alignment and to help prevent foot drop. So next position is orthopnic or tripod position. Orthopnic or tripod position places the patients in a sitting position or on the side of the bed with an overbed table in front to lean on and several pillows on the table to rest on. Orthopnic or tripod position places the patients in sitting position or on the side of the bed with an overbed table in front to lean on and several pillows on the table to rest on. Patients who are having difficulty breathing are often placed in this position since it allows maximum expansion of the chest. Patients who are having difficulty breathing are often placed in this position since it allows maximum expansion of the chest. Here it is the example of the orthopnic tripod position. So next position is dorsal recumbent position. In dorsal recumbent position or back-lying position, the client's head and shoulders are slightly elevated on a small pillow. In dorsal recumbent position, the client's head and shoulders are slightly elevated on a small pillow. This position provides comfort and facilitate healing following certain surgeries and anesthetics. This position provides comfort and facilitate healing following certain surgeries and anesthetics. This position is used for abdominal assessment because it promotes relaxation of abdominal muscles. This position is used for abdominal assessment because it promotes relaxation of abdominal muscles. So next position, supine or dorsal position. Supine or dorsal position. Supine is a back-lying position similar to dorsal recumbent, but the head and shoulders are not elevated. Supine is a back-lying position similar to dorsal recumbent, but the head and shoulders are not elevated. Just like dorsal recumbent, supine position provides comfort in general for patients recover after some types of surgery. Just like dorsal recumbent, supine position provides comfort in general for patients recover after some types of surgery. This is most normally relaxed position. This is most normally relaxed position. It provides easy assessment of head and neck, anterior thorax and legs, breast, axillae, heart, abdomen, extremities, pulses. In supine position, it is most relaxed position. It provides easy assessment of head and neck, anterior thorax and legs, breast, axillae, heart, abdomen, extremities and pulses. Next position is prone position. In prone position, the patient lies on the abdomen with the head turned to one side. The hips are not flexed here. This is the only bed position that allows full extension of the hip and knee joints. This is the only bed position that allows full extension of the hip and knee joints. To support a patient lying in prone, place the pillow under the head and a small pillow or towel roll under the abdomen. Prone position also promotes drainage from the mouth and useful for clients who are unconscious or those who recover from surgery of the mouth and throat. Prone position also promotes drainage from the mouth and useful for clients who are unconscious or those who recover from surgery of the mouth and throat. Prone position should only be used when the client's back is correctly aligned. Prone position should only be used when the client's back is correctly aligned and only for people with no evidence of spinal abnormalities. Only for people with no evidence of spinal abnormalities. Next position is lateral position. In lateral or side lying position, the patient lies on the side of the body with the top leg in front of the bottom leg and hip and knee flexed. In lateral or side lying position, the patient lies on the side of the body with the top leg in front of the bottom leg and hip and knee flexed. Flexing the top hip and knee and placing the leg in front of the body creates a wider triangular base of support and achieves greater stability. Flexing the top hip and knee and placing this leg in front of the body creates a wider triangular base of support and achieves greater stability. The greater flexion of the top hip and knee, the greater the stability and balance in this position. This flexion reduces lordosis and promotes good back alignment. Lateral position helps to relieve pressure on the sacrum and heels in people who sit for much of the day or confined to bed rest in pholos or dorsal recumbent. Lateral position helps to relieve pressure on the sacrum and heels in people who sit for much of the day or confined to bed rest in pholos or dorsal recumbent. Clients with respiratory difficulty do not tolerate this position. Clients with respiratory difficulty do not tolerate lateral position. In this position, most of the body weight is distributed to the lateral aspect of the lower scapula, the lateral aspect of the ilium and the greater trochanter of the femur. In lateral position, most of the body weight is distributed to the lateral aspect of the lower scapula, the lateral aspect of the ilium and the greater trochanter of the femur. This position aids in detecting cardiac murmurs. The lateral position aids in detecting cardiac murmurs. Next is Sims position. Sims position is a semi-prone position where the patient assumes a posture halfway between the lateral and prone position. Sims is a semi-prone position where the patient assumes the posture halfway between the lateral and prone positions. The lower arm is flexed at the shoulder and the elbow, both legs flexed in front of the client. The upper leg is more acutely flexed at both the hip and knee. than in the lower one. The upper leg is more acutely flexed at both hip and the knee than the lower one. This position is used to assess rectum and vagina. Sims position is used to assess rectum and vagina. Sims may be used for unconscious clients because it facilitates drainage from the mouth and prevents aspiration of fluids. Sims may be used for unconscious clients because it facilitates drainage from the mouth and prevents aspiration of fluid. It is often used for clients receiving enemas. Sims position is often used for clients receiving enemas. Pregnant women may find the Sims position comfortable for sleeping. Pregnant women may find Sims position comfortable for sleeping. Support proper body alignment in Sims position by placing a pillow underneath the patient's head under upper arm to prevent rotation. Place another pillow between legs. So next position is Trendelenburg position. This position involves lowering the head of the bed and raising the foot of the bed of the patient. Trendelenburg position involves lowering the head of the bed and raising the foot of the bed of the patient. Patients who have hypotension can benefit from this position because it promotes venous return. Patients who have hypotension can benefit from this position because it promotes venous return. Also, it is used for spinal anesthesia patient, post-spinal anesthesia patient. Next is reverse Trendelenburg position. It is opposite of the Trendelenburg position. Here, the head of the bed is elevated with the foot of the bed down. This is often a position of choice for patients with gastrointestinal problems as it can help minimize esophageal reflux. This is often a position of choice for patients with gastrointestinal problems as it can help minimize esophageal reflux. Next position is knee chest position. This position of a patient in which the weight of the body is supported on the knees and chest. The position of a patient in which the weight of the body is supported on the knees and chest. This position provides maximum exposure of the rectal area and also used in gynecological examination. Knee chest position provides maximal exposure of rectal area and also used in gynecological examination. Knee chest position also known as genupectoral position. Knee chest position also known as genupectoral position. Next position is lithotomy position. This position is used for assessment and surgeries related male or female genitalia and genital tract. Lithotomy position is used for assessment and surgeries related male, female genitalia and genital tract. This position provides maximum exposure of genitalia and facilitate insertion of vaginal speculum. This position provides maximum exposure of genitalia and facilitates insertion of vaginal speculum. So, therapeutic position video ends here. Thank you for watching this video. Please like and share this video and don't forget to subscribe our channel Dinners. Thank you.